Welcome to the new video MCQs on Bacteriology Part 3. Question number 1. A 25-year-old food handler presents with diarrhea and abdominal pain after eating egg salad. Stool culture shows non-lactose fermenting colonies that produce hydrogen sulfide on triple sugar iron agar. Which organism is most likely? Shigella dysenteriae, Salmonella enteritidis, Vibrio cholerae, E. coli. The right answer is option B, Salmonella enteritidis. Salmonella produces hydrogen sulfide that is blackening on triple sugar iron agar, and it is a common cause of foodborne gastroenteritis from eggs and poultry. Question number 2. A patient develops profuse watery diarrhea after antibiotic therapy. Colonoscopy shows pseudomembranous colitis. Which toxin is responsible? Alpha toxin, heat stable toxin, Shiga toxin, enterotoxin A and B. The right answer is option D, enterotoxin A and B. Clostridium difficile produces toxin A, enterotoxin, and toxin B, cytotoxin, which damages the colonic mucosa and causes pseudomembranous colitis, especially after broad-spectrum antibiotic therapy. Question number 3. A 7-year-old girl presents with sore throat, fever, and a strawberry tongue. Culture shows beta hemolytic colonies that are bacitracin sensitive. What is the likely organism? Streptococcus agalactiae, Streptococcus pyogenes, Staphylococcus aureus, Enterococcus faecalis. The right answer is option B, Streptococcus pyogenes. Streptococcus pyogenes, that is group A Streptococcus, is beta hemolytic, bacitracin sensitive, and causes scarlet fever, which presents with strawberry tongue, pharyngitis, and rash. Question number 4. A 60-year-old hospitalized patient develops ventilator-associated pneumonia. Sputum shows oxidase positive, gram-negative rods producing blue-green pigment and fruity odor. Identify the organism. Klebsiella pneumoniae, Acinetobacter baumannii, Pseudomonas aeruginosa, Legionella pneumophila. The right answer is option C, Pseudomonas aeruginosa. Pseudomonas aeruginosa is an oxidase-positive gram-negative rod producing blue-green pigments, pyocyanin and pyoverdin, and a fruity odor. It commonly causes ventilator-associated pneumonia in ICU patients. Question number 5. A 35-year-old woman with urinary tract infection shows gram-negative rods that are indole-positive and lactose-fermenting on McConkey agar. What is the organism? E. coli, Proteus mirabilis, Klebsiella pneumoniae, Enterobacter cloaceae. The right answer is option A, E. coli. Escherichia coli is indole positive and produces pink colonies on lactose fermenting McConkey agar. It is the most common cause of urinary tract infection in all age groups. Question number 6. A laboratory test detects anti-streptolysin O antibodies in a patient with carditis. What does this indicate? Current pneumococcal infection, past group A streptococcal infection, gonococcal arthritis, rheumatic fever due to Streptococcus agalactiae. The right answer is option B, past group A streptococcal infection. Anti-streptolysin O antibodies develops after infection with Streptococcus pyogenes. Question number 7. Which enzyme produced by Staphylococcus aureus allows it to clot plasma, helping to differentiate it from other staphylococci? Catalase, lipase, hyaluronidase, coagulase. The right answer is option D, coagulase. Coagulase converts fibrinogen into fibrin, causing clot formation. This enzyme is unique to Staphylococcus aureus, helping it to differentiate from coagulase-negative staphylococci. Question number 8. A 40-year-old man develops chronic cough after exposure to contaminated air conditioning systems. Culture shows a fastidious gram-negative rod requiring cysteine and iron for growth. Identify the organism. Legionella pneumophila, Haemophilus influenzae, Francisella tularensis, Brucella abortus. The right answer is option A, Legionella pneumophila. Legionella pneumophila is a fastidious gram-negative rod requiring cysteine and iron for growth. It spreads through air conditioning or water systems and causes Legionnaires disease. Question number 9. A 6-year-old child develops a swollen neck with grayish pseudomembrane in the throat. The ELIT test detects toxin production. What is the role of the tox gene? Encodes endotoxin, encodes exotoxin acquired by bacteriophage, encodes beta-lactamase, encodes capsule formation. The right answer is option B, encodes exotoxin acquired by bacteriophage. The tox gene of Corynebacterium diphtheriae is carried by a lysogenic bacteriophage, producing a potent exotoxin that inhibits elongation factor 2, causing pseudomembrane formation. Question number 10. A 5-year-old boy presents with bloody diarrhea after eating undercooked meat. Culture shows sorbitol negative E. coli. Which toxin is responsible? Heat labile toxin, heat stable toxin, Shiga-like toxin, cholera-like toxin. The right answer is option C, Shiga-like toxin. Enterohemorrhagic E. coli is sorbitol negative and produces Shiga-like toxin, causing bloody diarrhea and risk of hemolytic uremic syndrome after eating undercooked meat. Question number 11. A 3-day-old neonate develops meningitis. Gram-positive rods that show tumbling motility are seen. Which antibiotic is effective? Penicillin plus gentamicin, vancomycin only, metronidazole, ciprofloxacin. The right answer is option A, penicillin plus gentamicin. Listeria monocytogenes causes early neonatal meningitis. The standard treatment is to use penicillin plus gentamicin for synergy. Question number 12. A 20-year-old student presents with meningococcal meningitis. Which medium is used for isolation of the causative organism? McConkey agar, Thayer-Martin medium, XLD agar, TCBS agar. The right answer is option B, Thayer-Martin medium. Neisseria meningitidis grows on Thayer-Martin medium, which contains chocolate agar plus antibiotics. This suppresses contaminants and selects Neisseria species. Question number 13. A patient with prosthetic valve endocarditis shows gram-positive cocci in clusters that are coagulase negative. Which is the likely organism? Staphylococcus aureus, Enterococcus, Staphylococcus saprophyticus, Staphylococcus epidermidis. The right answer is option D, Staphylococcus epidermidis. Staphylococcus epidermidis is a coagulase negative staphylococci that forms biofilms, making it the most common cause of prosthetic valve infections. Question number 14. The causative agent of typhoid fever is best diagnosed during the first week of illness by which test? Stool culture, Vidal test, blood culture, urine culture. The right answer is option C, blood culture. In the first week of typhoid, Salmonella typhi is present in the blood, making blood culture the most sensitive early test. Question number 15. Which bacterium produces a safety pin appearance on bipolar staining and is transmitted by flea bites? Yersinia pestis, Pasteurella multocida, Francisella tularensis, Brucella melitensis. The right answer is option A, Yersinia pestis. Yersinia pestis shows safety pin appearance on bipolar staining and it is transmitted via flea bites causing plague. Question number 16. A patient with a cat bite develops wound infection. Which organism is likely? Brucella abortus, Francisella tularensis, Bartonella henselae, Pasturella multocida. The right answer is option D, Pasturella multocida. Pasturella multocida is found in cat and dog oral flora and it causes rapid wound infections after bites or scratches. Question number 17. Which test differentiates Streptococcus pneumoniae from Streptococcus viridans? Catalase test, Optochin sensitivity test, coagulase test, bacitracin test. The right answer is option B, Optochin sensitivity test. Streptococcus pneumoniae is optochin sensitive and bile soluble, whereas viridans streptococci are optochin resistant. Question number 18. A wound specimen shows double zone of hemolysis on blood agar. Which organism is responsible? Clostridium tetani, Clostridium botulinum, Clostridium perfringens, Clostridium difficile. The right answer is option C, Clostridium perfringens. Clostridium perfringens produces alpha and theta toxins, creating the classic double zone of hemolysis on blood agar, that is, inner complete hemolysis and outer partial hemolysis. This finding is a characteristic of gas gangrene. Question number 19. A 35-year-old man presents with a painless genital ulcer followed by generalized rash involving palms and soles. Which test confirms the diagnosis? VDRL test, ASO test, Vidal test, coagulase test. The right answer is option A, VDRL test. A painless chancre followed by maculopapular rash involving palms and soles indicates secondary syphilis. The VDRL test is a screening test that detects reagent antibodies confirming syphilis. Question number 20. A patient with tuberculosis is started on isoniazid. Mutation in which gene gives resistance to INH? RPOB, CATG, INHA, GIRE. The right answer is option B, CATG. Isoniazid requires activation by CATG gene encoded catalase peroxidase enzyme. Mutation in CATG gene leads to failure to activate isoniazid, which results in drug resistance. Question number 21. A 36-year-old man presents with a painless genital ulcer and enlarged inguinal lymph nodes. Dark field microscopy shows thin corkscrew-shaped organisms. Which test is used for screening? FTA-ABS, PCR, TPHA, VDRL. The right answer is option D, VDRL. A painless chancre and corkscrew-shaped spirochetes indicates Treponema pallidum. VDRL is the screening test for detecting reagent antibodies. Question number 22. A patient develops severe pneumonia with rusty sputum. Gramstein shows gram-positive diplococci lancet-shaped. Which virulence factor helps the organism escape phagocytosis? M protein, polysaccharide capsule, protein A, pili. The right answer is option B, polysaccharide capsule. Streptococcus pneumoniae is a lancet-shaped diplococci. Its main virulence factor is polysaccharide capsule, which prevents phagocytosis. Question number 23. A woman develops urinary frequency and burning. Urine culture shows strong urease production. Which organism is most likely? E. coli, Enterococcus, Proteus mirabilis, Klebsiella pneumoniae. The right answer is option C, Proteus mirabilis. Proteus mirabilis is a urease-positive organism. It breaks down urea and makes the urine alkaline, causing stone formation. It is the most common cause of urinary tract infection with burning and frequency. Question number 24. A 28-year-old man develops watery diarrhea after consuming undercooked seafood. Growth on alkaline media is seen. Which is the causative organism? Vibrio cholerae, Vibrio vulnificus, Vibrio mimicus, Campylobacter jejuni. The right answer is option A, Vibrio cholerae. Vibrio cholerae grows best in alkaline media and it is linked with contaminated seafood. It causes profuse watery diarrhea due to cholera toxin. Question number 25. A gardener presents with chronic ulcers and nodules along lymphatics. Gram staining shows cigar-shaped yeast, but culture grows gram-positive branching filaments first. Which bacteria-like organism may mimic this in early stages? Actinomyces, Nocardia, Mycobacterium, Streptomyces. The right answer is option B, Nocardia. Sporothrix shows cigar-shaped yeast, but early cultures can grow gram-positive branching filaments. Nocardia is a partially acid-fast branching filamentous bacterium that can mimic this. Thank you for watching the video. Subscribe to the channel to learn more MCQs on microbiology.